Did you know a group of patients once reversed heart disease, without surgery or drugs, just by changing what they ate? That headline stopped me in my tracks. Because I've lived through the stents, the pills, the low-fat lies. And last week, I decided to try something different. I never imagined I'd say this at 76, but I gave up bacon last week. Not forever. Just for 7 days. 7 days of no meat, eggs, or cheese, not even my morning coffee with cream. Just plants. Greens, legumes, oats, and nuts. Things I once called rabbit food. And yet, I did it. I, Harold Bennett, a retired history teacher from Ohio, who grew up on fried chicken and sausage gravy, went full plant-based, for 1 whole week. Now, I know what you're thinking. Why would a man like me, who's lived through heart surgery, who takes 3 pills every morning, suddenly decide to eat like a monk? It wasn't for trend. It wasn't for weight loss. It was because of a sheet of paper. A single, wrinkled photocopy of my cardiologist was handed to me in a waiting room. At the top, it read, Dean Ornish, 1990, intensive lifestyle changes may reverse coronary heart disease. Reverse? Do not slow down. Not manage. But reverse? I looked at my doctor. He just smiled. You should read this, Harold. It changed how I treat patients. It might just change how you live the rest of your life. That night, I read it all. 28 patients. No drugs. No surgery. Just lifestyle. And the results? Blockages shrinking. Chest pain vanishing. Hearts healing, without a scalpel in sight. I sat back in my chair. The lamp buzzed. The room was quiet. And I whispered. Could food do that? This is the story of what happened next. What I ate. What I felt. What surprised me. And why, even after just 7 days. I'll never look at a lentil the same way again. For most of my life, I thought I understood what it meant to take care of my heart. You know the drill. Don't eat too much fat. Watch your salt. Walk a little every day. Take your pills, and see your doctor twice a year. And I followed that advice, at least, I thought I did. I switched from butter to margarine. I ate grilled chicken instead of fried. I even skipped the bacon, sometimes. I thought that was enough. I thought I was being responsible. But in reality, I was just delaying the damage. I wasn't healing. I wasn't reversing anything. I was patching cracks on a sinking ship. Then came the stairs. Just 7 steps to the upstairs bedroom. Steps I had taken for 20 years without a second thought. But that day, halfway up, I couldn't breathe. My chest tightened like a steel belt. My jaw felt heavy. I leaned on the rail, waiting for the pressure to ease. It did. But the fear? It stayed. That night, I stared at the ceiling and thought. What if this is it? What if the next one doesn't go away? So, I went to see my cardiologist, Dr. Benjamin Lawrence. He's younger than me, sharp as a tack, Ivy League smart, but doesn't make you feel dumb. He looked over my labs, my EKG, and said something I didn't expect. You're stable, but you're not improving. Then he said, I want you to try something. It's not new, but most people still haven't heard of it. He reached into a drawer and handed me a thin packet. At the top, it read, Intensive Lifestyle Changes for Reversal of Coronary Heart Disease, Dean Ornish, 1990. I squinted. Reversal? You mean, not just slowing it down? He nodded. This study was published in The Lancet, one of the world's most respected medical journals. 28 patients. All had measurable coronary artery disease. They followed a plant-based diet, did some light exercise, and practiced stress management. No statins? I asked. No bypass? He shook his head. No surgery. No medication. And after 1 year, their arterial blockages shrank. Their chest pain disappeared. Their blood flow improved. I was stunned. Not skeptical, stunned. Because no one had ever told me it was possible to undo heart disease. Only manage it. Postpone it. Hope it doesn't get worse. I took that packet home and read it cover to cover. There were diagrams. Before and after scans. One man had a 91% blockage that shrank to 56% in a year. Another had angina so bad he couldn't walk to the mailbox. 6 months later, he was hiking again. I sat there for a long time. Lamp on. Coffee cold. And I felt something I hadn't felt in years. Hope. Not the passive kind. Not, hope the pills work. This was active hope, the kind you could put on your plate. So I made a decision. Not a big one. Not forever. Just 7 days. 7 days. No meat. No dairy. No shortcuts. What happened next changed everything. Day 1. The kitchen felt quieter than usual. Maybe it was the absence of bacon sizzling on the stove. Maybe it was the way I stared at a bowl of oatmeal like it was some kind of alien artifact. No butter. No cream. No sugar. Just steel-cut oats, a sprinkle of walnuts, and a few slices of banana. I poked it with my spoon. Even Duke, my golden retriever, looked at me with that tilted head expression, like he couldn't figure out what was going on. I took a bite. It was fine. A little bland. But not terrible. That was breakfast. Lunch was lentil soup. I added some carrots and celery and threw in turmeric because the article said it helped with inflammation. Dinner. Steamed broccoli, sweet potato, and half an avocado. No oil. No sauce. No shortcut. By the end of the day, I wasn't hungry in the usual way. I was empty, yes, but lighter. It felt like my body was working to process what I ate, not just storing it for a rainy day. I went to bed wondering if I could do this for 6 more days. Not because of the food, but because of the voice in my head saying, "You're 76, Harold. What difference can a few plants make now?" But that voice got quieter by morning. On day 2, I noticed something. I woke up without the usual bloated feeling. My hands didn't feel as stiff. I leashed Duke and headed out for our walk. Same route. Same pace. But something felt easier. I wasn't gasping at the hill like I used to. Just a little less resistance. Nothing dramatic, but it was there. That's when it hit me. This wasn't about miracle cures. This was about momentum. By day 3, I added some quinoa, roasted chickpeas, and I even baked tofu for the first time. I looked up how to season it. Garlic. Paprika. A little lemon. It didn't taste like steak, but it didn't need to. It was mine. And for the first time, I started enjoying the act of cooking, not just eating. I also began journaling. Not calories. Not macros. Just how I felt. After lunch, energy level 6 out of 10. No brain fog. After dinner, no heartburn tonight. It became a new kind of health tracker, but one rooted in how I lived, not just what I consumed. This wasn't a vegetarian diet for heart patients. It was an experiment in listening to my body, something I hadn't done since Reagan was in office. Day 4 brought the first surprise. I took my blood pressure out of habit, something I'd been doing daily since my bypass years ago. The reading was a few points lower than usual. Nothing massive, but enough to make me look twice. That downward arrow on the little screen. It made me smile. Could a plant-based diet for heart health do that, in 4 days? I started getting curious. I pulled out old logs, compared numbers, and reviewed meals. There was a pattern. Less processed food. Less salt. More color on the plate. More fiber. More effort. And yes, more flavor. The weirdest part. My digestion was smoother. Bathroom breaks were, well, less dramatic. My daughter would roll her eyes if she heard me talk about this, but trust me, at 76, regularity is a gift. On day 5, something shifted. I didn't just follow the plan anymore. I owned it. I wasn't doing this to be good. I wasn't chasing a number on a scale. I was chasing ownership. Of my health. Of my choices. Of the few remaining decades I hoped I still had. I didn't tell anyone except my daughter. She called on FaceTime and noticed the greens on my plate. "Dad," she laughed, "are you trying to join a yoga cult?" I laughed too. But in truth, I was beginning to feel like a different man. A lighter man. A man who didn't just want to avoid disease, but wanted to reverse it. Gently. Naturally. On his own terms. That's when I revisited the Dean Ornish paper. I highlighted a sentence that stuck with me: the body often has a greater capacity for self-repair than we've been led to believe. If given the right environment. And maybe, just maybe, cholesterol-lowering foods for seniors didn't have to be bland. Maybe they just needed attention. Love. Consistency. You know, it occurred to me, people talk a lot about life insurance for seniors with heart disease. But what if the best insurance was just life? Not extending it with more pills, but improving it, one bite at a time. By the end of the week, I had more energy. I slept better. My thoughts felt clearer. The cravings for salty chips. Still there. But more like an echo than a demand. And the fear I carried up those 7 stairs a week earlier. It started to fade. Not completely. But I could feel something new taking its place. Confidence. Confidence that I could do hard things. Confidence that I wasn't too old to change. Confidence that maybe, this old heart wasn't done healing just yet. When I started this little plant-based experiment, I didn't expect much. I mean, come on, I'm 76. My arteries have been through decades of Sunday roasts and buttered toast. How much could change in a week? But I promised myself I'd be honest. So I went in for my checkup. They took my blood. Checked my blood pressure. Same routine. Same machines. But when I got home and opened the report that evening, I had to read it twice. Systolic pressure, down 6 points. LDL cholesterol, 9 points lower. Triglycerides, significantly better. I didn't believe it at first. I kept flipping pages like there must be a mistake. But there it was, proof. Not just feelings. Not just lighter steps or clearer thoughts. Proof inside my body that something had shifted. And the best part? I didn't suffer. I didn't starve. I didn't spend a dime more than usual. I just ate real food. Food my great-grandmother would have recognized. Plants. Whole grains. Legumes. Nothing magic. Just a simple plant-based diet for heart health. And yet, somehow, it worked. For the first time since my heart surgery, I felt like my body wasn't fighting against me. It was working with me. Like I was giving it the tools it needed, not just pills and prescriptions, but actual fuel. That night, I sat down with my little spiral notebook. Same one I've been using to log meals and moods all week. But this time, I added a new column, changes I noticed. It wasn't just the numbers. It was sleep. energy, digestion, peace of mind. It hit me then, this wasn't just about cholesterol. It was about taking back the steering wheel, after years of letting fear drive. So I made a copy of my notes. Printed out a simple table with 7 days across the top, little boxes for meals, sleep, walks, blood pressure, and mood. I called it the Green Plate Tracker. Not because it's fancy, but because it worked. And I posted it, just quietly, on a Facebook group for seniors. No big speech. No preaching. Just 1 week. Plants only. My numbers dropped. I feel clearer. I made this tracker if anyone wants to try. It's free. I don't sell anything. I just thought someone might need it. And the next day, there were replies. Not hundreds. Just a few. Some curious. Some skeptical. One man said he'd been wanting to try but didn't know how to start. And in that moment, sitting there in my flannel shirt, reading those comments, I felt something I hadn't felt in years. Useful. Not just alive. Not just surviving. But connected. This wasn't about being perfect. It wasn't about converting anyone. It was just sharing what worked. In case it could help someone else start their own 7-day story. And honestly, I think that might be the real medicine. It wasn't just the numbers that changed. Something inside me was shifting. The way I walked. The way I breathed. The way I sat with my morning tea and felt the silence, no longer as heaviness, but as peace. By day 8, I woke up before my alarm. That used to happen because of chest tightness. Now, it was just energy. Clean. Gentle. Present. I wasn't chasing some perfect health guru routine. I was just showing up for myself. Each bite I took, lentils, oatmeal, berries, felt like a message I was sending to my body. I haven't given up on you yet. And for the first time in a long time, my body was answering back. Not with pain. Not with fatigue. But with clarity. Clarity in my thoughts. Clarity in my emotions. Even the way I looked at the world was different. The tree outside my kitchen window had been there for 30 years. But that morning, I noticed how the sun hit its leaves just right. How it shimmered. I hadn't seen it in years. I used to think this kind of talk was nonsense. Sentimental fluff. But now I understand, when your body isn't drowning in inflammation or fatigue, your heart has more room to feel joy. That was the real surprise. It wasn't just that my blood pressure dropped. Or that my cholesterol went down. It was that my spirit, whatever that is, felt a little more alive. And I realized something important. The food wasn't just fuel. It was communication. Between the cells in my body. Between the version of me that was tired, and the one that still had some fire left. People think reversing heart disease naturally is about avoiding surgery. And yes, that's part of it. But to me, it's also about getting my life back. Getting the moments back. The flavor. The clarity. The quiet victories, like walking upstairs without fear. I still take my meds. I still check my pulse. But now, I also check in with myself. How do I feel after eating? Did I move today with intention? What small choice did I make that my future self will thank me for? That, to me, is health. Not numbers on a chart. But little moments of power. And to think it all started with lentils, greens, and a notebook. I don't know where this journey ends. But I know one thing for sure. It's not too late. Not at 76. Not if you're willing to start with what's on your plate. I don't know if Dean Ornish will ever hear this. He's a busy man. A brilliant one. A man who, decades ago, dared to say something most doctors still avoid. The heart can heal itself. That food is not just nutrition. It's information. That lifestyle isn't just a factor, it's the foundation. I didn't believe that at first. Not really. When I first saw his name on that old paper in my cardiologist's office, I thought, oh, another health preacher. Another man with a theory. But now, 7 days later, I've changed my mind. And if I could send him one message, it would be this. Dr. Ornish. I'm 76. I'm not famous. I don't run marathons. I've lived a quiet life, just me, my dog Duke, a few books, and a small porch in Ohio. But this week, you changed something in me. Not just my blood pressure. Not just my cholesterol. You changed my relationship with food. For years, I've eaten like most people do, habit, taste, emotion, boredom. But now, for the first time, I eat like I believe in myself again. I feel clearer. I feel lighter. I feel proud. And I'm not done. I've made copies of your 7-day approach. I've shared them with old high school friends. With men in my bowling league. With 2 neighbors. Because if a stubborn, bacon-loving man like me can feel this good, anyone can. Thank you. Not for saving my life. But for reminding me it was still mine to live. I don't know if he'll ever read it. But it felt good to write. It felt whole. Like closing the loop between a stranger's research and my quiet life. It reminded me that healing doesn't always come with headlines. Sometimes, it comes in whispers, over lentil soup, over a walk in the morning, over a quiet decision to try again. And maybe, that's the point. You don't have to change the world to matter. Sometimes, you just have to change dinner. If you've made it this far, thank you. You didn't have to. But you did. And maybe that means, something in this story touched something in yours. I'm not here to tell you what to do. I'm just here to remind you of what's possible. Not decades from now. Not after surgery or more pills. But maybe, 7 days from now. With one quiet decision. One honest plate. One small promise to yourself. So if you're ready, start. Don't wait for perfection. Don't wait for motivation. Just start. And if you do, I'll be right here. Not ahead of you. Beside you. Still learning. Still healing. Still hoping. Because the truth is simple. The heart remembers how to heal. Sometimes, it just needs you to go further.